Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You've heard the saying, you are what you eat. Well, it turns out there's some truth to that. Joining us to talk about food as medicine is Dr. Mitch Biermann. He's an internist with the Scripps Clinic Medical Group in San Diego, California. Doctor, thanks so much for being with us.
Thank you.
So, what does it mean to use food as medicine?
The way I think about it is replacing the different foods we eat with healthier alternatives.
And so, how do you detoxify your body? First, say, what does that mean to detoxify your body? And then, how do you do that?
I think of detoxifying your body as taking out all the processed food that we put into it and replacing it with healthy alternatives.
And so, what are the top five healing foods?
Well, again, I think these go to the idea of replacement. There's no silver bullet. There's no one food that's absolutely a miracle thing. It's about replacing unhealthy things with healthier choices. So if I had to choose five foods, I would choose olive oil because olive oil raises good gut hormones more than butter, say. I would use tomatoes because you can't have a Mediterranean diet without tomatoes. I would choose quinoa because quinoa raises your blood sugar less than rice or bread. I would choose yogurt because, again, yogurt is fermented, and so it will raise your blood sugar less than, say, milk would. And I would choose dragon fruit because dragon fruit and many tropical fruits like that, despite them being dripping and sweet, will raise your blood sugar less than watermelon, pineapple, or kind of what we think of as normal fruit.
But fruits and vegetables, by and large, are all good.
Of course.
And what about raw versus cooked versus fried food?
I think raw food in general is better, and I think cooked food is in general better than fried food.
And what's the problem with fried food?
Fried food just contains a lot of saturated fat in general.
So what about food for energy throughout the day? What should you be eating?
So I think the short answer is protein and unsaturated fats like grapeseed oil, olive oil, and protein would be lean proteins like chicken or fish. The things I think that people think of as giving energy are usually foods that are really high in sugar, like a big bowl of cereal, any kind of sugar sweetened beverage like orange juice, soda. Those things give people energy in a kind of a short term way. You call it a sugar high, right? But then people tend to crash afterwards, right? And lean proteins like fish and chicken, polyunsaturated fats like olive oil, grapeseed oil as a way of cooking food mostly, right? Those are the things that give people energy in kind of a more sustained release fashion throughout the day.
So there's been a lot of talk about red meat. Some say it's okay to eat it once in a while. Others say you should avoid it altogether. Is it healthy?
I don't think there's a right or wrong answer to whether red meat is healthy or unhealthy. I think it can definitely be a part of anyone's diet. And in particular, certain red meats, especially like lean pork, lean beef, things like that, are relatively low in saturated fat and very high in protein, obviously. And so they can give you a lot of filling in your diet too that can reduce your total calories, maybe, compared to an entirely carb-based diet, for example. Macaroni and cheese has no red meat in it, but that doesn't make it healthy.
Are there eating patterns or certain foods that actually improve certain chronic conditions, such as arthritis, for example?
Not really. I think the only thing we truly know about diet is that unprocessed is better than processed, basically. And for arthritis, the main thing you want to do is take off the mechanical load on your joints. So, in other words, to lose weight.
So, what are the top five things that should be on everybody's grocery list?
So, I think the top five things that should be on everybody's grocery list are chicken, fish, fruits, vegetables, and yogurt. All of those things will, if you eat them, reduce the total number of carbs you eat in a day and increase protein.
So, what recipe would you recommend for somebody who doesn't have much time to cook? Because a lot of folks say they go by the fast food restaurant on the way home, pick stuff up because they don't have time to cook at home.
Mm-hmm. So I don't think, unfortunately, that there's such a thing as good fast food, or really even good processed food, of which fast food is kind of the worst genre of it, right? I do think though that there are easy things people can eat as snacks, or people can just eat as meals that are fast to make. So for example, if you get Greek yogurt and put in some, berries like blueberries and blackberries, you can actually get fairly full without doing anything, right? You can literally just take a spoon and eat the yogurt, right? So I think there are things for snacks that if people look at their diet and look at what types of foods they eat, so if you're, for example, if it's a dairy thing like ice cream, and you switch it with yogurt, right? You can have the same time, but you can be a lot healthier.
And you could just peel a nectarine and eat it. That's pretty fast.
And fruit, yeah, fruit it comes in its package. Usually you unpeel the banana peel, you unpeel the orange peel. It comes prepackaged even.
Doctor, what small changes in our diets would most improve our health?
I think the small changes in our diet that would most improve our health is, again, looking at your diet and trying to find just little things that you can substitute that would be improvements that don't require you to count carbs and don't even require you necessarily to make a huge quantity change like portion control in your diet. So for example, think about the major carb you eat. It's probably going to be either bread or rice. So if it's rice, make sure it's not white rice. Make sure it's a combination of brown rice, beans, and like wild rice that are put together in a mixture that is healthy. Or you can switch it with quinoa, which is a similar thing. If it's bread, try to look for the most tart bread you can, the sourest bread you can, usually sourdough bread, because again, that would have less of an effect on your blood sugar than just plain white bread.
Any final thoughts, doctor?
I think the most important thing you can do for your diet and your overall health is to look at what you're eating and see the little areas for improvement that you can make, the simple substitutions that will just be better, right? You can do that before you think about portion control. You can do that certainly rather than doing math and counting calories. So if you eat a lot of white rice, switch it to brown rice. If you eat a lot of bread, switch it to sourdough bread. If you eat a lot of ice cream, switch to yogurt. Those are the kind of things, those little substitutions that will add up over time and make you healthier.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you, Sue.
If you'd like more information on food as medicine, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.